I'm really pleased to have UF alumni who all took fixing healthcare delivery share their advice on starting out as an intern. For me personally, and I think for most people, this was the most exciting time of our lives. You can get off on the right foot right from the start. It'll make an amazing difference. So we've found over the years that this has been very helpful and very well received. We're going to start out with Denis Balaban present. He's going to introduce himself and tell you what he's been up to and then some of his advice.
All right. Well, thank you, Dr. Southwick. Yeah, I'm Denis Balaban. I am a recent graduate of the Mass General Brigham neurology residency, staying at Mass General for the Advanced General Autoimmune Neurology Fellowship. That's a mouthful. But yeah, so some advice for interns. So I would say that intern year for me, at least, was a bunch of unknowns. You know, I didn't even know where the bathroom was. I was trying to figure out what's going on with the service. I was on the heart failure service, which is like the super subspecialized cardiology service. And they were throwing around acronyms that I had no idea what they meant. This is normal. This is what intern year will feel like initially. And every place has their own set of acronyms, I feel like. So one thing that I did that I got really positive feedback on was to always ask questions if you don't know what's going on. So on that heart failure service, for example, I felt like I was asking a billion questions every single day on rounds. And the fellow actually one day just stopped rounds and like pointed at me and was like, I like that you're doing this. Keep asking questions. It makes me feel way more at ease working with you. I would be far more worried if you weren't asking questions because I wouldn't know if you knew things or not. And now I kind of know where you are. And I know that I can trust that if you don't know something, you're going to find out or ask somebody. So I would highly encourage, if you don't know something, you're not sure what's going on, ask questions. And kind of piggybacking off along that, on rounds, it's okay to be wrong. You will be wrong. Everyone's wrong on rounds, you know, when they're first starting. One thing I learned in the ICU, especially, was to like very confidently just state the plan, state what you want to do. And because that way it gets through faster, and you have put your nickel down. And then you have your senior, your fellow, your attending as 3 levels of safety to be like, I like that, but no, we're not doing that. We're not doing that because of these reasons. Here's your feedback in the moment, moving forward. And then you've learned right there. So it's okay to be wrong. Embrace it and accept the corrections and the learning as it comes.
Dave, do you have any suggestions as far as rounds?
So I'm Dave Boone. I graduated 2016. I am a Gen Cards fellow at UTH. I graduated from medicine there in 2019. Right now I've been doing a lot of rotations where we do procedures and stuff. But from what I remember as an intern, I guess an anecdote would probably be like the best thing for me to give you. So when my first month on CCU as an intern, because, you know, wanting to do cardiology, I remember being very overwhelmed. So this kind of will pertain to people who are kind of anxious about starting on something maybe that they want to do in the future where they have to apply again, and wondering how it will affect them in the future. But I didn't know anything about cardiology at that time. Very, you know, just enough from whatever I needed for the boards, for USMLEs and things of that nature. And I remember one of my attendings, who's a really good friend of mine now, asked me, you know, when was the patient last on dopamine? And I didn't know how to look at when the last time they were on dopamine. And some of you may already know, but there's a way to look at it in the MAR where it can show you what time it was turned off and so on and so forth. So I remember I had no idea, and he turns to me and he just bears down on me. You got to know this stuff. You're a doctor now, blah, blah, blah. And I remember feeling so terrible that day. And there will be moments like that throughout the entire first year, days that make you want to quit, days that make you feel down. And then there will be opposite days where you're like, wow, I'm really glad I did this. And I guess my point for telling this story is don't let those days get you down too much. I thought after that day I would never be a cardiology fellow. And here I am and going into my third year. I think that's important to remember when you're doing medicine. I think right now medicine has become extraordinarily competitive. I think the best advice I can give is to not let yourself succumb to that. There's nothing they can do that should get you to a point that should make you want to quit. But there ultimately it will happen. There will be someone who's just a jerk, especially depending on your program. There will be people who go to programs and everything's hunky-dory and they never deal with that. You're a med student. One thing that I was always told was actually the opposite of what Dennis was saying, which I like that Dennis is a question asker, but a lot of people always told me, say less, do more, ask less questions, which I always thought was like the dumbest thing in the world. And it is. But as a med student, you really do get told to don't ask as many questions because it shows how much you don't know. So you get used to this training of, hey, maybe I won't ask this. I'll just Google it first. But at that point, you don't know what you don't know. So you don't know if your question is Googleable. You don't know if it's something you need to know. And I think in medicine, it becomes so difficult to know when you're supposed to ask a question and when not, because people can be so harsh on you. So that's my biggest advice is do what Dennis says and ask questions, a lot of them. And just remember that nothing of what you're about to do should ever be taken personally, even if someone is trying to make it personal.
As an attending, I really love when interns ask questions. That means they're interested in their patients, they're concerned about their patients, and they want to learn, and they're inquisitive. So that is always, as an attending, that is always a plus. I have never had an intern that asked too many questions. So I do not think you can ask too many questions, as Dennis said. Now, Meron, what are your thoughts?
So my name is Meron. I'm an internal medicine, public health, and primary care physician at the Cincinnati Health Department. So finished residency last year from Johns Hopkins, and also went to medical school with Dennis. And I definitely agree with what's been said before. Dennis definitely practiced, asking questions and not being afraid to ask questions, even when we were medical students. And I remember looking up to him for that. I definitely agree about what's been said so far. I think when you go from being a medical student to an intern or resident, there's a huge mental shift that needs to happen. I think sometimes medical school, or at least, third and fourth year, can seem performative in some way, more than you do. You're being evaluated, so you're always nervous. But I think when you're finally a physician and an intern, you really need to shift to a growth mindset and be willing to ask things that you don't know about, because, you're in charge of patients and your actions can have huge consequences. So pretending not to know something and pretending like you understand something can have dire consequences when you're needing to act more independently. So I definitely say ask. I think when I was an intern, I felt very unprepared. I thought everyone knew more than I did, and felt like I had to figure things out. And I didn't realize that there were layers of protection. That there was, senior resident who was being supervised by an attending, and even the attendings were also consulting with specialists or other colleagues to figure out the answers. So I thought, I was scared to prescribe like Tylenol, and just was so anxious, thinking that patients were depending only on my answers, and that's not the case. So I think being very open to ask questions on rounds is really important. And like Dave said, I think you're going to have some really good days where you feel very proud of yourself, but you're also going to have some really difficult days where you feel like you don't know how you got in that place, where you have that imposter syndrome, where you think, everybody's smarter than me, they're going to find me out, how am I here? And I think on those days, it's really important to have a good support system.
In the next video, we will be discussing social connectedness and self-care.